This daily vitamin formula is a multivitamin product that is used to address or prevent vitamin deficiency caused by a lack of nutrients in your diet, certain illnesses, or during pregnancy. Vitamins are essential for the body and play a crucial role in maintaining good health. Take the daily vitamin formula by mouth, usually once a day or as directed. Follow all directions on the product package, or as directed by your doctor. Do not take more than the recommended dosage. If you have any questions, ask your doctor or pharmacist. Take the medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Some common side effects of this medication include constipation, diarrhea, or upset stomach, but they are usually temporary and may go away as your body adjusts. If these effects persist or worsen, contact your doctor or pharmacist. Your doctor has determined that the benefits of this medication outweigh the risks of side effects. Most people using this medication do not experience serious side effects. A serious allergic reaction to this drug is rare, but seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of potential side effects, so if you notice any other effects, contact your doctor or pharmacist. If you are in the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, report side effects to Health Canada at 1-866-234-2345. If the multivitamin you take has iron, it's crucial to keep it away from children. Accidental overdose of iron-containing products is a common cause of fatal poisoning in kids under 6 years old. If an overdose happens, seek medical help immediately or call a poison control center. Make sure to let your doctor or pharmacist know if you're allergic to any of the ingredients in the daily vitamin formula, or if you have any other allergies. It's important to also inform them of your medical history, especially if you have liver or stomach/intestinal problems, or if you use/abuse alcohol. If your brand of multivitamin contains folic acid, be sure to tell your doctor if you have a vitamin B12 deficiency before taking it. It's also important to inform your doctor if you're pregnant or breastfeeding before using this medication. And before having surgery, make sure to let your doctor or dentist know about all the products you're using. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Don't start, stop, or change the dosage of any medicines without your doctor's approval. If your multivitamin contains iron, avoid taking it at the same time as antacids, bisphosphonates, levodopa, thyroid medications, or some antibiotics. Ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. If your multivitamin contains folic acid, be sure to tell your doctor or pharmacist if you take certain anti-seizure drugs. This medication may interfere with certain lab tests, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. If someone takes too much daily vitamin formula and has serious symptoms like fainting or difficulty breathing, they should call 911. Otherwise, they can call a poison control center. In the U.S., residents can call their local center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include stomach pain, nausea, vomiting, and diarrhea. Be sure to attend all your medical and lab appointments. Certain brands of daily vitamin formulas may include additional ingredients like docusate. If you have any questions about the ingredients in your specific brand, be sure to ask your doctor or pharmacist. It's important to remember that this product is not a replacement for a healthy diet. It's always best to get your vitamins from nutritious foods. Make sure to maintain a well-balanced diet and follow any dietary guidelines given to you by your doctor. If you forget to take your daily vitamin formula at the scheduled time, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next one at the regular time. Don't take extra to make up for the missed dose. Remember to store your daily vitamin formula at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes time to get rid of the product, make sure to properly dispose of it by consulting your pharmacist or local waste disposal company. And remember, don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.